Good morning, folks. I'm glad you're all here. Thank you very much for joining me. It's Wednesday, April 24th, 2024. I want to thank many of you who have sent me cups of coffee. Thank you so much. May God bless you. Thank you. I got a fresh pot on right now. How many of you actually trust the government? How many of you actually trust the FDA? I'm sure you've heard about the H5N1 that is in our milk supply. A lot of dairy cattle across the country have been found to carry the virus. The FDA said today that particles of the avian influenza have been found in milk from grocery stores, indicating the highly pathogenic virus has made its way into America's commercial milk supply. The FDA said in a statement it has been testing milk from cattle that have been sickened with the influenza, commonly known as bird flu, or H5N1, as well as milk in the processing system on the shelves. They're currently testing to see if it is, in fact, active virus. They don't know. So they are telling the public, based on available information, Pasteurization is likely to inactivate the virus, but they're not positive. They say the process of pasteurization is not expected to remove the presence of viral particles. Therefore, some of the samples collected have indicated the presence of HPA1. During their testing, it was found, the agency did say. They are also telling the public that the samples tested positive. But that does not mean they contain an intact pathogen, maybe just only part of the particles. The DNA has been broken down. Additional testing is required to determine whether intact pathogens is still present, so they don't know. And they don't know if those particles, or what they did find with the pathogens, remain infectious. What they are doing right now is injecting samples into fertilized chicken eggs to see whether any active virus replicates, among other experiments. They are also testing samples taken from pasteurized milk from across the nation. They are not saying where the milk was found that contains the bird flu. Do you trust them? Do you trust them with your children's lives? Even though right now they're saying that to date we see nothing that would change our assessment on that commercial milk supply is safe. They're not going to know the results of their testing maybe for days or even weeks. For now, the FDA is tight-lipped about how many samples were tested and which stores the milk that tested positive came from. Yanner Baryam, president of the New England Complex Systems Institute, said on the social media platform X, formerly known as Twitter, that the finding means that milk from sick cows is being used. While pasteurization likely means the milk is safe, that safety is not guaranteed. Angela Rasmussen said it's hard to say more, as no raw data was shared, so we just have to take their word for it. Meaning we have to take the FDA's word for it that it could be safe, but they're not positive. The USDA previously said that milk from dairies with sickened animals was being diverted or destroyed so that it does not enter the food supply, and that pasteurization has continually proven to inactivate bacteria and viruses like influenza in milk. But yet they admit no studies on the effect of pasteurization on HPA1, such as H5N1 in milk, have previously been completed. So they haven't done any complete tests to find out if pasteurization actually kills the virus. So now they're testing, but we won't know maybe for weeks if it's true. Currently, highly pathogenic avian influenza has infected 33 herds of livestock in 8 states, which is Idaho, New Mexico, Texas, South Dakota, Kansas, Michigan, Ohio, and North Carolina. They are saying that human infections with the avian bird flu are rare, but a dairy worker in Texas who had close contact with an infected cow developed a mild eye infection, probably pink eye, I think. But what about people who have compromised immunity systems? Luckily, supposedly for now, no human-to-human transmission has ever been recorded. Do you play the lottery? Do you gamble? Because right now it says that the CDC says that the human health risk to the U.S. public from HPA1 bird flu remains low. I don't know. What are the chances, right? Are you willing to take the risk? Put your comments down below. So they keep telling everyone not to use raw milk. Well, this is not in raw milk. This is now in pasteurized milk. So what are your thoughts? Please put your comments down below. Thank you very much for watching. Please like, share, and subscribe. And thank you again for the cups of coffee and the PayPal donations. Please stay safe. And I'll talk to you later. God bless you all. Bye.